Hey guys, Dr. Ben Thompson here, founder of Treble Health. In this video, I want to connect with you and share what I learned over the last 5 years since I started making videos and eventually opened a private practice that is now blossoming into opening physical locations alongside our telehealth practice. So I'll share what I've learned as we've seen over 5,000 patients for either consultations or treatment. We have a lot of data and a lot of knowledge, and this has really impacted my life on an emotional, personal level. I did not expect all this to happen. I had very humble, simple goals at the beginning. So in today's video, I'm going to share all of that with you. This is also very unscripted. I have some notes written down of what I plan to say. Hopefully you can sit with me and see the human in this experience, see the openness of my intention and what we've done and all the people we've helped and what I've learned along the way, some good and some bad. I started Treble Health because I had an interest in helping people in the audiology space. I decided to become an audiologist. That was a decision I made as a 20-year-old. And then I graduated. I went straight into the doctoral program in San Francisco, California. In that program, I had a great mentor, one of the top doctors from UCSF, the lead tinnitus specialist. He taught 2 semesters of coursework for me, and I was sitting in the front row, very engaged. I loved helping people with tinnitus. At that time, I liked the fact that it used a more holistic, comprehensive approach. It was focusing on not only the ears, not only hearing devices or hearing tests, but also the emotional being, stress, anxiety. It was helping people reduce their suffering. Along those same timelines, I was stepping into things like meditation, yoga, and nature, outdoor adventure. It just fit me as an audiologist. It really piqued my interest. And I ended up doing the residency at UCSF, studying under one of my mentors, Dr. Troy Kasha. He taught me everything that he knew, and I graduated from that program with a lot of skills in tinnitus. During that residency at UCSF, which was a year long, I had a patient drive 4 hours to see me for an appointment. They live in Lake Tahoe, California. They drove from the mountains all the way to San Francisco, and they explained to me that the patient saw their local physician, their primary care physician. They went to an audiologist, but they went to an ENT doctor as well. But they were giving nothing for tinnitus, and they started to freak out. They were really worried. They were concerned. How could they live with this forever? What do you mean there's nothing that can be done? What do you mean there's no cure? Well, the patient found UCSF online. They drove for the appointment, and I conducted a tinnitus specialized appointment. That appointment could have been done virtually. It could have been done remotely over Zoom, and the patient got so much out of the appointment. And then they drove back to Lake Tahoe. Now, of course, they stayed a night in a hotel. I'm not suggesting that someone drove 8 hours in one day. But the point is that the tinnitus patient is massively underserved. There's so few doctors that know what to do for tinnitus treatment. And I saw that as an opportunity. I saw that as a problem for the actual patients. And I thought that my unique skill set of growing up in the Bay Area, living amongst entrepreneurs, technology. So I saw an opportunity there. At the time, I had helped UCSF start the telehealth program that they ended up using a lot during COVID. But fast forward a few years, and I was finally ready to take a go at this, to start a YouTube channel and eventually be able to offer telehealth services. My original, motivation for starting Treble Health was I wanted more freedom and creativity in my job as an audiologist. I was working at a nonprofit at the time in the Bay Area, in Oakland and Berkeley, California. I liked the work I was doing. I liked helping people. I liked that I was speaking Spanish with a lot of patients who only spoke Spanish. However, I felt like I had sort of hit my limit where I wasn't growing that much. After years of contemplation, I decided, okay, I'm ready to start this YouTube channel. And that was one of the best decisions I ever made. I was actually on a hike on the Pacific Crest Trail where I was with my friend. We were hiking for a week in Oregon on the PCT, backpacking, camping. Great time. It's one of my favorite activities. But on that specific trip, just had a lot of time to do a sort of walking meditation and self-reflection. And I realized that being in nature, having everything slow down, calm down, being able to connect with my why is that I wanted to make a big impact, and I wanted to have more creativity and freedom in my job as an audiologist. I saw tinnitus patients and working with tinnitus patients as the thing that I was most excited about. And I also wanted to work remotely. So there was an obvious connection here of maybe those things can come together. Now, way back in the day, I remember seeing two YouTubers in the audiology space, one from England, one from Australia. Julian Cowan-Hill from England, who's a therapist, and Joey Remini from Australia, who is an audiologist. And I thought, well, I think I'm just as smart as them. I think that I have unique things to share just as much as them. If they can help people through YouTube videos, then why can't I? There's no one in the United States who's specializing in tinnitus who's on YouTube helping patients. So I gathered some equipment. I spent $1,000 on the equipment, and then I decided that I was ready to start making YouTube videos. And I told myself, this might take 5 years before I can quit my regular job, but I'm committed to it. Even if it takes 5 years, I'm all in on this idea. That really took off, and the first videos I made were in March 2020. So the pandemic really accelerated this growth for me, because just a few months prior, I was ready to start making videos. And then I had all this time. I was living alone. I was single, did not have a girlfriend at the time. I didn't even have a car. I was in an apartment, and I had the camera equipment that I invested in, and I learned how to make YouTube videos, and that's been my life ever since. What else I've learned along the way? Well, first of all, I'll show you this cool thing. So this is the YouTube plaque. You can see I have one there on the back as well. It's the silver plaque they give for 100,000 subscribers. And I actually ordered extras of these because we're opening physical brick and mortar locations here. So I got these extra silver plaques because for anyone of you guys who wants to come to our clinic when it's open in July 2025, you're going to be able to see the YouTube plaque, as well as either meet me or potentially, one of our doctors who's working at the clinic. All right. Other reflections that I've learned are that my beliefs had changed. So at the very beginning, I used to think that tinnitus was a pretty basic or relatively straightforward treatment. You get hearing aids, you do some counseling. That was good enough. That was sufficient. Even at UCSF Medical Center, a top 10 hospital, the type of care I was seeing, it was thorough. There was a few appointments involved, but it was mostly hearing aid focused as well as counseling focused. It was using tinnitus retraining therapy. Now, foreshadowing, I later went on to study tinnitus retraining therapy and was a student of the founder, Dr. Pavel Jastroboff. You can see on the screen right here, Dr. Jastroboff and I visited him at his summer home. So tinnitus retraining therapy was the core message that UCSF Medical Center was teaching. So that's what I learned. But what I found out, my beliefs changed because that approach they were doing was fairly basic. Just 1 or 2 appointments plus hearing devices. Now, years later, after I've just obsessed about doing the best care that's out there for tinnitus, what I've learned is that a comprehensive approach is key. That involves sound therapy treatment, yes. That involves specific types of counseling and one-on-one guidance, yes. But that can also involve parts of cognitive behavioral therapy, mindfulness, guided breathing techniques, bimodal stimulation. Other pieces of this, they can all really come together in a way that when it's done right is a comprehensive treatment for the patient. So my beliefs have changed that now I know the best tinnitus treatment is so much more than just a relatively basic approach that I'd seen at the hospital. I want to share 2 stories. These really exemplify what we're doing here and what is possible with tinnitus. First patient is Steve. Steve is a pharmacist out of New York City. You can see I actually interviewed Steve right here at our New York City event last year, and Steve had some great things to say. Let's hear from Steve for the next 15 seconds or so about what he learned about tinnitus.
Don't give up. Believe that it gets better because it will. It does get better, but you have to trust it and trust yourself, and trust your system that over time your brain will adjust and kind of replace the sound with normal sounds. And that's what it did.
I love that. Steve's such a great guy. So Steve's actually a pharmacist who developed tinnitus. And one of the first things he did was understand, hey, is there any medications or herbal supplements that can help with this? Just like any good pharmacist would. He found that there's no science-backed, evidence-based treatments that are pharmaceutical-based or medication or pills or herbal supplements for tinnitus. He found there wasn't anything that's going to help him. But you know what he did? As part of trying everything and the kitchen sink included, he actually tried herbal supplements because they had no negative side effects, and he was so desperate for help. And I think that really exemplifies an important point here of what I've learned. Even someone who is a pharmacist, a doctor of pharmacy in New York, who researched and found, no, there was no pill that's going to help his tinnitus. He was suffering so much and he needed so much help that he still tried herbal supplements. He still tried the pills that were marketed and available online. Not because he thought they would do anything for him, but because what did he have to lose? Now, Steve worked with my team at Treble Health. He followed our treatment program. We helped him along the way. He's doing so much better now. And of course, he's sharing his story because going through tinnitus is really tough. And when you've been told by multiple doctors and the internet that there's nothing you can do or there's no cure, but then you get better and you realize none of that stuff was true. Tinnitus is challenging to get better. Not every single patient gets better, but there's absolutely things that we can do. So Steve is someone who exemplifies this perfectly, that this condition can be really hard. It can make people really desperate. And when you get help, then sharing that message back to the community is so important. And that's exactly what he did. The second patient I want to mention here is Jeff. Jeff lives here in Northern California, and Jeff went through our tinnitus treatment program. This is virtual Zoom visits. He worked consistently. He also had sound therapy devices acting as hearing aids for him. He focused on the sound therapy. He focused on guided breathing, managing anxiety and stress. He focused on fundamentals of CBT, cognitive behavioral therapy, and he consistently did this over many months. I believe he worked with us for over 6 months, between 6 and 12 months consistently for the sessions and the treatment. And guess what? He got better. He still has some tinnitus. If you ask him, hey, how did the treatment go for you? He says, I am so much better. I feel back to normal. Yet he still has some tinnitus. He returned to many of our group coaching sessions, which we run twice per month for our existing patients. It's a great community. And Jeff shows up offering his help, offering hope and support. He shows up to these meetings and says, guys, I was where you were. I thought there was no hope. I was really struggling. I couldn't sleep. I was anxious. I was a ball of stress. But he shows up to these meetings to say, look at me now. He has gotten so much better. He habituated. The tinnitus sound isn't really a bother anymore. It's significantly lower, but he still has it. And I think that patient story is so important because it teaches us that you don't need this to completely go away to get better. When people say there's no cure for tinnitus, they're correct. There's nothing to make it go completely away that works for all patients. But there's many other health conditions as well that don't have a cure, but absolutely have treatments that are manageable. And I would put tinnitus in that bucket as well. So thank you, Jeff, for sharing and showing up so strong. One thing that really surprised me that I've learned over the years after we've helped over 5,000 tinnitus patients is so many people are told that there's nothing that can be done. It's shocking to me that with all the tools and information we have, that many ENT doctors and physicians and some audiologists, I'm an audiologist, so I'm not going to, bash them too hard right now, but some physicians are still telling patients, you have tinnitus, there's nothing that you can do about it. Good luck. Or, hey, there's no cure for tinnitus. You could try this, you could try that, but nothing really works. Or, hey, I'm so sorry you have tinnitus. I have it too. I'm fine. I think you just need to kind of get used to it and try to not think about it. Man, those are so painful to hear, aren't they? Those are like, oh, it's like a knife in the heart. It's like our patients are told those things and they interpret that as there's no hope. I'm stuck with this forever. How can I live like this? This doctor has no understanding of what I'm actually going through if that's how they're talking to me. Ooh, it's heavy. So, I've learned that part of our mission at Treble Health is actually educating physicians, educating the medical community that there is something that can be done. So, for example, this summer, I'm attending an ENT conference in Florida where we're speaking to a lot of ENT groups, and that's going to be my message. Shake everyone's hand and say, hey, there is something that can be done for tinnitus. Do you have a referral partner? Where do you send patients who have tinnitus? And many of them in the past, I know having these conversations, they say, yeah, we don't really have anything for tinnitus. All right. So that's what I've learned. Additionally, my brother Garrett and I were both audiologists. We run Treble Health, and him and I went to the ENT conference a few years ago in Philadelphia. You can see us right here on the screen right now. And we spoke with many doctors. We spoke with many physicians. and they were very receptive and open to hearing what was available for them and for their patients. And many of those same people we spoke with still refer their patients to Treble Health today. So that's part of our mission, and that's one thing I've learned over the years, is that it's more than just the patients we're seeing, but it's also the YouTube videos we're making, giving people hope, giving them information. It's also the physicians and the doctors that patients are going to. As I said at the beginning, this was a humble start. I just wanted to be my own independent practitioner, independent provider, basically run a telehealth private practice. But it reached a point where my schedule got full and I realized, okay, I have a few options here. Either I just do an online course, or I raise my prices significantly, or I hire other audiologists and grow a brand more than just me. And I asked myself, in decisions like this that are related to helping people and being user-centric or helping patients, patient-centric, I asked, what's best for the patient? What's best for you? Online course, it has its place, but I don't believe that's the way. Raising prices so only, a select few people can afford them, that's not who I am. I'm not money driven. I'm more community impact driven. So what's best for the patient? Having more providers, offering more services, being more available and accessible to patients. So that's the decision I made back then. And now, like 3.5, 4 years later from that decision, that has really grown way past what I thought was possible. So we currently have 9 audiologists on our team, doctors of audiology who specialize in tinnitus. They are excellent. I've hired every single one of them. I've been a big part of their training. The level of care that we provide for the tinnitus patient is top 0.1%. I mean, there are a few people in the world that are really going as comprehensive as we are into the tinnitus care and helping patients through this process. So an average patient with our team will have 10 appointments within the first 6 months. That's a lot of time, right? Think about someone who gets hearing aids from an audiologist. They might see them 2 or 3 times, and then they're kind of on their own. That's not enough for tinnitus. So there's a big opportunity there that we're filling that gap. We also have 3 patient care coordinators, and we have a large video editing team to make all of this possible. Shout out to the video editing team. The team that provides the care is so essential. Think about, why do people choose the best surgeon in their city? Why do people want the best lawyer who solved that problem? Why do people want a dentist with very good reviews? We want to trust the person we're working with has actually done this before and specializes in this. So they're not going to mess up my health. They're not going to fall short of the best treatment outcome I can have for my tinnitus because they don't have the skills and they don't have the right system in place. And I'm just happy to share that we've built an amazing system for patients with tinnitus, and our data supports that, where we've helped over 5,000 patients and over 2,000 of them have gone through our comprehensive tinnitus treatment. And using what I learned at UCSF, but it built upon that way more, it's bringing in the tinnitus retraining therapy with Dr. Jastroboff's teachings, and it's just expanded into all this comprehensive approach that can really help our patients. So where do we go from here? What does the future look like? Well, I'm happy to share that we are opening new clinics. We're opening physical brick and mortar clinics. Telehealth is still growing and still doing amazing, but additionally, we know that some of you guys want to be seen and prefer to be seen in person for a real in-person fitting of the devices, programming of the devices, and having that face-to-face human connection. We'll be opening a new location in San Francisco, California, as well as South Florida in Weston, which is just west of Fort Lauderdale. So let me explain a little bit about what you can expect there. In San Francisco, we have Dr. Priscilla Gilaire, who's an audiologist and tinnitus specialist. I recruited her to join our team from UCSF Medical Center, where she was working on the tinnitus treatment team. We came to an agreement, and we're opening a physical location alongside an ENT clinic in San Francisco. And I'm really excited about this partnership because we're going to collaborate with one of the leading ENT clinics in San Francisco. I'm very excited about it. If you want to check out more information, find the link below to learn about this clinic, see some photos, and get a sense of what it's going to be like. I hope you guys can come. Definitely be there. Additionally, we have the clinic in South Florida, and I'm excited to announce I hired Dr. Trisha Scaglione, who's an audiologist and tinnitus specialist. In my opinion, she's top 5 tinnitus specialist in the United States in terms of her knowledge, her empathy, her performance, how she really, can connect with patients and give them the best treatment. So she formerly worked at University of Miami Health for over 10 years and was the lead tinnitus specialist. So that's South Florida's leading medical center for tinnitus, and she was leading it. Well, after years of trying to convince her to join Treble Health, we finally found an opportunity that was perfect for everyone, and that is opening a clinic in Weston. Now, Weston, Florida is a special place. It's actually where the Cleveland Clinic is in South Florida, and it's perfectly situated where patients can travel there from the south, from Miami, from the east, from Fort Lauderdale, from the north, from Boca Raton and Palm Beach. Went down there in Florida. We found the most beautiful clinic that I have ever been in, and we got a lease for us to move in. So Treble Health is moving in. We have Dr. Trisha, who is very well connected in the area and revered for her passion for tinnitus. She really wants to work with tinnitus patients. And a fun fact about Trisha is that she travels a lot. She has a lot of world travel experience, and she was on the Wheel of Fortune. Let's pull that up there. So she was actually on the Wheel of Fortune as an audiologist. I think that's pretty cool. And she's going to be hopefully on our YouTube channel making some videos with me. So if you want to learn more about the Florida location as well, go ahead and check out the link in the description or visit treblehealth.com to learn more. Guys, I really am so appreciative of you. The fact that I can speak to you through this camera and you can hear me and we can connect, it means a lot. This is one of my favorite things about what I'm doing here and helping tinnitus patients, is communicating with you guys and building a real connection. So I'd love to answer any thoughts you have in the comments and hear what's going on in your life. And if you are in Northern California or South Florida, connect with us, come to our clinic, book an appointment or a free telehealth consultation. And if you want to keep your eyes out for our new clinics that we're launching, follow us, Treble Health, here on YouTube. Guys, it's Dr. Ben. I'll see you soon. Thanks so much.